My name is Harriet Wheelock and I'm Keeper of Collections in the Royal College of Physicians of Ireland. I'm going to start this webinar by giving a brief introduction to the history of vaccination, focusing on the vaccine for smallpox, which was the first vaccine to be developed. Hopefully this will set the scene for the talks which follow and identify some themes that they will discuss. The history of vaccination begins with smallpox, which was one of the deadliest infectious diseases in human history. The origins of the disease are unknown, but records indicate outbreaks occurring from the 3rd century BC across Africa, Asia and Europe. Much as with the spread of COVID-19 this year, smallpox spread across countries and continents with the movements of people. It was carried to America and the Pacific Islands by European colonisers from the 16th century onwards, and death rates from smallpox in these areas were extremely high as the native populations had never been exposed to the disease before. The initial symptoms of smallpox were fever and vomiting. Those infected then developed a skin rash which turned into fluid-filled bumps. These eventually formed scabs which fell off to leave the disease's characteristic scars. Death rates from the disease usually range from between 20 to 60%, but could reach up to 80% in children. Those who survived were often left with severe scarring of the skin and in some cases blindness. Some researchers have estimated that in the 20th century alone, between 300 and 500 million people died from smallpox. It was noticed that those who survived smallpox did not suffer from a recurrence of the same disease, and this led to the development of variolation, the intentional infection of one person with material from the scabs of another person who was suffering from a mild form of smallpox. This practice was first recorded in China in about the 10th century, from where it spread to the Ottoman Empire. Although records of the practice were well known in Europe by 1700, there was resistance from the medical profession to what was seen as an unhygienic and unsafe practice. The acceptance of the practice in England is largely credited to one woman, Lady Mary Wertley Montague. She was familiar with the devastation caused by smallpox, having lost her brother to the disease. She herself had also suffered from smallpox, which had left her badly scarred. As wife to the ambassador to the Ottoman Empire, she saw the practice firsthand and volunteered her 4-year-old son to undergo the practice in 1718. On her return to London, she used her position and connections to campaign for the adoption of smallpox variolation by the wealthy and educated population of London. The practice spread to Ireland and was first recorded in the opening years of the 1720s. In 1725, Brian Robson, later president of this college, published an account of the inoculation of 5 children in Dublin. Robson's account shows the limits of the practice, as 2 of the 5 children died as a result of the procedure. The name that is most associated with the development of the smallpox vaccine is Edward Jenner. Although he was the first to publish his research, he was just one of several contemporaries researching in the area. Jenner and others had noticed that milkmaids who contracted the mould of cowpox from dairy cows, which only caused blisterings on the hand, seemed to have a resistance to smallpox. On the 14th of May 1796, Jenner tested his theory, inoculating 8-year-old James Phipps with pustules from the hand of the milkmaid Sarah Nelms, who had been infected with cowpox from a cow named Blossom. James contracted a low-grade fever, but otherwise remained healthy. A few days later, Jenner intentionally infected James with smallpox. The normal sign of the disease did not appear, and James remained healthy. The inoculation with cowpox had protected James from the much more serious smallpox. Jenner published his research and, after some hesitation, his method of inoculation was accepted by the medical world. The procedure was given the term vaccine or vaccination, from the Latin word for cow, vacca, to honour Blossom's contribution. In her research into smallpox in Ireland in the 18th century, Gabrielle Ashford has shown that in the first half of that century, smallpox was responsible for 20% of all deaths in Dublin and 1/3 of all child deaths nationwide. These rates, which were considerably higher than in other countries, demonstrated the potential importance of vaccination to Ireland. The first smallpox vaccination was carried out in Dublin in 1800 by John Creighton, surgeon to the Foundling Hospital in Dublin. He opened his dispensary for infant poor and vaccine inoculation in March of that year and vaccinated 9 children, including his own son, within a year. State support soon followed, and in April 1803, the Lord Lieutenant requested the presidents of the College of Physicians and the College of Surgeons to consult on, quote, the best mode of propagating and preserving genuine cowpox matter in Dublin for transmission by post. Within 8 months, the Cowpox Institution was founded on North Cope Street. It provided vaccination clinics 2 days a week in Dublin and a postal order vaccine service for practitioners outside of Dublin. Within 3 years, 2,966 inoculations had taken place in Dublin, and 3,240 packets of vaccine had been distributed around the country. Despite this early adoption of vaccination in Ireland, acceptance was low. Dr. Samuel Labatt, who headed the Cowpox Institution for over 40 years, wrote of the need to, quote, overcome strong prejudice against vaccination. He campaigned tirelessly for 40 years for the adoption and managed to persuade key individuals and organisations, including the Catholic Church, to support the practice of vaccination in Ireland. In 1840, the first vaccination legislation was passed in Ireland. It put the responsibility for vaccination onto the poor law guardians. This was unfortunate as it associated vaccination with the social stigma surrounding the workhouses, and this impacted on uptake rates. In the reforms of the poor laws which followed the tragedy of the famine, vaccination was moved from the workhouses to the new dispensaries established across the country. In addition, responsibility and incentives were given to the medical practitioners for vaccinations, and the number of annual vaccinations rose to close to 100,000 per year by 1860. Compulsory vaccination of newborn infants was introduced in Ireland by an Act of Parliament of 1863, and rates of vaccination increased by a third, with an estimated 85% uptake by the end of that decade. Interestingly, compulsory vaccination legislation was more successful in Ireland than in other parts of the United Kingdom. This may have been because the legislation was introduced in Ireland at the same time as the registration of births. Dispensary doctors were invited to be the new registrars for births, and 700 of the 756 practitioners in the country accepted. This streamlined the process of registration, vaccination and certification. Between 1871 and 1880, there were 7,550 deaths in Ireland that were attributed to smallpox. Between 1901 and 1910, the number of smallpox deaths in Ireland was just 65. From the beginning, vaccination faced opposition in some quarters. This opposition strengthened following the introduction of compulsory vaccination. In 1896, the National Anti-Vaccination League brought together several smaller groups into a central organisation, and a sister organisation, the Irish Anti-Vaccination League, was founded in 1905. Opposition to vaccination was based on the argument that it was doing more harm than good. Cases were reported of vaccination leading to infection with other diseases such as syphilis, or resulting in the death of the infant being vaccinated. Sometimes these claims were accompanied by the accusation that the medical profession was suppressing this information when registering the deaths. For others, the issue with vaccination was that it was compulsory and that it removed the free choice of the individual. Opposition to vaccination tended to be quite localised, and Dublin and Wexford were often identified as areas of high vaccination defaulting. The College of Physicians took a leading role in countering anti-vaccination sentiment. In 1910, the college published a statement on vaccination directed at the Enniscorthy Union, where there seems to have been a recent rise in anti-vaccination sentiment. The report expressed, quote, grave concern of the introduction into Ireland of the crusade against vaccination and the spread in certain districts of this country of the pernicious doctrines taught by the opponents of that beneficial practice. The statement goes on to use a combination of statistical information and historical precedent to show the value of vaccination, concluding, with all the evidence before them, and having regard to the strict precautions which are taken at the present day to secure that only the purest vaccine limp shall be used, the President and Fellows would urge the people of Ireland to cling to their faith in a preventative measure which has rid their native land from one of the most terrible plagues which has ever afflicted the human race. In Ireland, the anti-vaccination campaign became, for some, linked to Irish nationalism. This intensified after a conscientious objection to vaccination was passed in England in 1898, but not extended to Ireland. Among the members of the Irish League at the start of the 20th century were several prominent names, including George Bernard Shaw, Francis Sheehy Skeffington, and Eamon de Valera. The outbreak of the First World War saw increased enforcement of vaccination legislation and a corresponding increase in opposition. Political independence in the 1920s did not settle the issue, and vaccination opposition continued. However, an attempt to get a conscientious exemption to vaccination passed in 1928 in Ireland failed. Interestingly, the debates at the time raised the perceived historical association of nationalism and the anti-vaccination movement. Despite this opposition, the value of smallpox vaccination in protecting the population from a previously devastating disease was established. In the decades and centuries following Jenner's research on smallpox, scientists researched new ways to improve the smallpox vaccination and continued to develop vaccines for other diseases. Vaccines would be developed for a host of serious, previously life-threatening diseases, including cholera, diphtheria, typhoid, whooping cough, TB, and polio. Following a sustained campaign by the World Health Organization during the 1950s and 1960s, smallpox was declared eradicated worldwide in 1979. Following this announcement, nearly all known stocks of the virus held in laboratories were destroyed. Smallpox remains one of only 2 infectious diseases to have been eradicated worldwide. The development of the vaccine and its implementation have saved hundreds of millions of lives.